Well, hello everyone. Welcome again to episode 11. Is it 11? Yes, it is 11 of the Caring Neurologist with our beloved Dr. Sandeep Thakkar, who's been teaching us a lot about our brain, which is very good because our brain is there and we don't know enough about it. We don't know anything about it actually, right?
I feel like we're learning a little bit more and more, though. We're getting a good understanding, and hopefully, those that are listening to this podcast, they feel a lot more empowered, regardless of having Parkinson or not. I think there's hopefully a lot of real life practical teachings that come from here. And today's going to be one of the most important that I think affects everyday people, including Parkinson's. But we really get to dive into a critical topic.
Absolutely. I'm not going to say anything yet. I'm going to start by congratulating you because we just got the numbers and the Caring Neurologist is number one in not one, not two, but so many countries, is one of the biggest podcasts. And I want to congratulate you. And I do believe that it is because what you are doing here is in a very easy language, in a language that everyone can understand. You're giving very, very valuable information. So congratulations.
Thank you. We're humbled as a team. I can tell you that. I think one of the best comments that I got from a patient actually was that it was so easy to understand, and the topics that how our dynamics are and communicating questions to answers has been pretty seamless. So the fact that people are commenting on that, it makes a world of a difference. And so the key thing is that on different countries, you said that we are number one on different platforms. I think that we're reaching the masses, so that's great.
That's amazing. And talking about the masses, I am sure the masses are going to love this episode because I know I'm going to love it because it's one of my favorite topics in the world, which is sleeping. And I do believe people are not aware of how important sleeping is. Parkinson's or not Parkinson's. I mean, the episode today is the hidden connection, Parkinson's and sleep disorders. But I think it's going to be broader because sleeping is key to anyone and everyone's health. Is that so?
Without question. Sleep's the most important thing. In fact, the moment that we started talking about sleep, I was thinking, did I get a good night's sleep? And how's my day going to be based on how I slept? And it really is so fundamental. I mean, we spend, for some of us, I mean, if we think about it, 30% to 50% of our time asleep in our lives, right? A good percentage of our time is asleep. And the real data could be that, if it's 30% of our time asleep, we better utilize that properly. And that way we can function the other 70% of our hours awake in the best possible way.
You're absolutely right. And I had never thought about it like that. We spend at least half our day, well, hopefully, half a day sleeping.
Yeah, it's key. We gotta important topics to cover that I know we're going to help a lot of people, and it'll be exciting to dive in.
Okay, let's get right into it. Dr. Thakkar, many people don't realize that Parkinson's can start affecting sleep before any movement symptoms appear. Why is sleep such a critical and often overlooked piece of the puzzle?
So it's been overlooked in the past, but I think the movement disorders, those that have specialized in Parkinson's, we are understanding more and more that there's a syndrome called a prodrome syndrome. Prodrome means before it happens. So sleep is critical in Parkinson's. These are sleep disturbances significantly impact the overall quality of life. And it may be part of the manifestation about what is progressing as the disease, as it starts, as it then develops. As we talked in one of the first few episodes, the disease of the brain actually starts in the gut. And abnormal proteins may spread, and these abnormal proteins spread from the gut and they work their way up. One of the first non-motor symptoms of Parkinson's is the constipation aspect, right? And constipation is one of those pathways in the nervous system around the gut that these abnormal proteins hit first. The second component may be part of maybe even pathways to the heart, and there may be even irregular heartbeats or some slowness or fatigue. But also, as it works, as the abnormal proteins work their way up the brain, they get to the brainstem. And in the brainstem is a critical area called the raphe nucleus. It's very important for connections for serotonin. And if abnormal proteins are irritating that pathway, we may start seeing sleep disturbances years before, decades before. And it's, again, one of those, we call it non-motor symptoms of Parkinson's. And the other non-motor symptoms we'll get to kind of address and talk about how sleep's interacted is fatigue, depression, and then cognitive decline associated.
Wow. Well, now that we're talking about sleep, I think there are some words that we usually hear, but I don't know if people are really aware. For example, REM sleep, and different kinds of sleep. Could we do something really quick, and try to understand, I don't know if it's the way to put it, the phases of sleeping?
Yeah. So we go into like a light wave sleep, we go into deep sleep, and then we get into REM sleep. And between the light sleep and the deeper stage of sleep, it has different nomenclature. And, when we are kind of in a wake state and we're trying to go to sleep, this is a light wake sleep. So we can kind of be in a state where we're about to fall asleep. And if we're interrupted, then we have to restart again. And then we get into more deeper stages of sleep. And that's where we're making some degrees of dream states, and there's certain areas of the brain that, again, getting into more rested state to allow us to recycle, recharge. And then we get into REM sleep, and REM sleep is very important, where the body itself is totally relaxed. Maybe there's some rapid eye movement. So REM stands for rapid eye movements. So the eyes may flutter, eyelids may flutter, but the body's in a catatonic state, completely relaxed. And this is the only time of the day that you're actually truly relaxed. And it's, again, very important for recharging. What ends up happening is you go through lightweight, deep sleep, and then you get into this REM sleep. And you do this in a 90-minute cycle, and then that kind of repeats. But as the night goes on, the REM sleep should be, if it's not disrupted, getting larger and larger. So you get into really deep stages of relaxation. Hopefully that makes sense.
That makes absolute sense. And so REM is rapid eye movement.
Rapid eye movements.
Okay. You once said there are no stupid questions, and I'm going to ask a question, which may be stupid. Just sometimes when you are about to fall asleep, you feel like you're gonna, you have I don't know how to explain it. You feel like you're falling and you just jump all over the place. Is that something that the brain is doing?
Yeah. The unique thing about we call them parasomnias. Para means parallel or adjacent to. So parasomnias is around going to sleep, whether that's going to sleep or waking up from sleep. And a lot of neurological conditions actually occur around that time. Some people can get like a jerk where they're about to fall asleep and their body gets finally relaxed, and this energy that's still in them kind of makes them jerk, myoclonic jerks. Some people can even get seizures around the time, if they already have a seizure disorder, by the way, that they have more frequency of seizures around going to sleep or waking up. And then there's also those situations where people may have migraines upon awakening. You also may see something called hypnagogic or hypnopompic hallucinations. And sometimes you see things that are not there. So your brain plays tricks on you in those areas of that light stage of sleep.
That the brain is something really, really amazing. Okay, let's go to the podcast, because I could be asking you questions for 3 hours. And let's start with REM, sleep behavior disorder. What exactly is RBD? And why is it being recognized as one of the earliest warnings of signs of Parkinson's?
So we talked about REM. REM is rapid eye movement. It's normal to have REM sleep. When you have normal REM sleep, the body, again, as talked about, is paralyzed, right? It's in a dream enactment state. In REM behavior disorder, that's when that paralysis mechanism malfunctions. That's when people are now moving in their sleep. When their body's supposed to be relaxed, they're acting out their dreams. They may jerk, they may fight, they may punch. In fact, they may accidentally physically act out their dreams as if they think they're jumping or they think they're running. A lot of patients with Parkinson's or in the prodromal phase where they don't know that they're having Parkinson's and it's developing a decade before, they may violently act out their sleep to the point where they may even punch their spouse, their loved one. They may yell, they may mumble in their sleep, and then once in a while, erratically kick or again act out that dream state. Now, these can happen in bunches where it could be just once a week, once a month, can happen once every 6 months. So this isn't happening every night. These are, again, the REM behavior disorder is, again, it's like an upside down REM sleep. And these, again, get easily missed because the spouses are like, oh, it's just a bad dream. And, you don't typically get just bad dreams in your, late 50s, early 60s or 70s. So if you are starting to get these vivid dream states where maybe you're mumbling, punching out, falling out of bed, this, again, are warning signs. And it's probably one of the earliest warning signs for developing Parkinson's, because as I mentioned earlier, the area of the brainstem has probably been affected, and these abnormal proteins have probably been attacking that area first.
Okay, but just to make this clear, falling out of bed once is not a sign of Parkinson's.
Not necessarily. No, it is not. There are a lot of people who have normal sleep issues. Maybe you can get into a vivid dream state because of certain irritabilities to the brain before you went to bed, right? Maybe some people could have watched a scary movie. Maybe they are on certain medicines. Maybe you had caffeine too late and then you feel anxious, and even in your sleep state, your heart's always beating. So there's a lot of things that can aggravate sleep. But if you see patterns, right? If you're seeing patterns once every 6 months, once every 3 months, people are talking to sleep or they're acting out their dreams where they may fight. This is something that's unique. And I worked with a lot of veterans and worked with the VA for many years. And many of my patients had what's called PTSD, where they would fight in their sleep. And this was, again, after being in battle, after combat, in their 30s and even up in their 40s, they were still having these vivid dream states. And that's what it looks like in someone who's developing Parkinson's, in their 50s or 60s. So some of my VA patients would say, oh, my PTSD is acting up again, and it hasn't acted up for, 10 years or 20 years. So then it makes me think, well, what's going on? And as we know, veterans have been at higher risk factors with like Agent Orange and other chemical exposures to developing Parkinson's.
Okay, so let's make it very clear. What kinds of sleep issues do your patients with Parkinson's commonly report, and how do these change over time? Because I know when we talk about these things, people get really scared because they're like, oh my God, yesterday, I don't know, I fell out of bed or something. So let's try to make it very, very clear.
So we talked about REM behavior disorder, right? REM sleep behavior issues. That's RBD. The other thing that patients with Parkinson's, whether it's early on or it's during the disease, there's other sleep disturbances that include insomnia, and we'll break it down into all of these. Excessive daytime sleepiness can be a sleep-related issue. Restless limb syndrome or restless leg syndrome, as most people commonly know it as. And then the other common sleep issues actually is painful leg cramps. And then there's also urgency of waking up to go to the bathroom quite a bit. So let's break it down into the common sleep issues like insomnia. This is difficulty falling asleep, staying asleep. While with the diagnosis of Parkinson's, sometimes just being diagnosed, there's a lot of anxiety. We see a lot of patients come to us and say, ever since you told me about the diagnosis, I can't sleep. And so that's not uncommon early with that kind of stress, right? But even as a disease state, sometimes we're taking medications to help control their symptoms. Their tremors are stable. They're not too rigid during the day. And then they're not taking really medicines at night to control their symptoms. So that maybe they're just not in a ideal state of staying asleep where they're relaxed, can easily turn over. Their muscles are a little stiffer and slower. Maybe their tremors are coming back, so it irritates them. And sometimes that is part of their insomnia. And then patients have also the way you would think of it is, yeah, you're asleep at night, but you still need to function during the day. But there's a lot of excessive daytime sleepiness. So patients during the day, they wake up, they eat a meal, breakfast or lunch, and they feel tired, like they're in an exaggerated food coma. Even if they didn't eat too much, or they're watching TV and they keep dozing off, right? So this is the type of thing where the sleep disturbances really negatively impact quality of life. When someone is going to sleep, their legs, when they're laying flat, and this is usually actually a dopamine dysfunction, which is restless limb syndrome. When you have a low dopamine state, the legs feel uncomfortable. They get this creepy, crawly sensation. In fact, you can actually get it in the limbs as well, in the hands. And people have to move around to get comfortable. And that phenomenon, restless limb syndrome, can also be a prodrome of Parkinson's. Even a decade before getting symptoms, people can have that restless limb features. And as the disease may progress, you may see some people get what's called central sleep apnea, where the brain's not sending signals to have proper oxygenation at night. And then you can have that fragmented sleep. Now, one comment about the sleep apnea is, we don't know if sleep apnea itself, obstructive sleep apnea or central sleep apnea, before the diagnosis of Parkinson's, increases the risk of getting Parkinson's, but we do believe it does.
Okay, you were talking about the restless leg syndrome, and that is when you are just moving your leg all over, right? All the time.
When you're laying flat or sitting down, like some people get in a movie theater, or if they're laying down in bed, then because they're laying down, not moving, all of a sudden they feel uncomfortable that they have to move their legs.
Okay, great. With these issues, the thing is that I think this happens to me, and I believe it happens to many of our listeners, that they go like, oh my God, but sometimes I need to move my leg, or oh my God, but sometimes I think we should all go to your consult, right?
Well, and that's the interesting thing is, I work with a lot of sleep doctors, and sleep doctors who come see me when there's this kind of these comments about vivid dream states or restless limb syndrome. When they start hearing these things and the sleep study initially comes back normal, there's no other sleep issues, we get a lot of referrals from our sleep doctor, because then it's our duty to pay attention to, is there anything else that's going on, whether the medications that can aggravate, or vice versa, could this be the beginnings of something like Parkinson's? But not everyone who has these symptoms develops Parkinson's, but that's the key thing, is we do need to monitor and watch for those at risk.
Okay. Can poor sleep make Parkinson's symptoms worse during the day? I mean, what is the connection between quality of rest and motor function, mood, or cognition? And I do ask about Parkinson, but okay, let's get to that question, and I'll ask you something afterwards.
Sure. Well, yeah, poor sleep aggravates the daytime motor control for patients. I mean, it affects their motor control for sure, their mood and cognition. The way I look at it is, when the brain is fully intact as far as energy, and it's got its resources and it's a good night's sleep, you can accomplish everything. Your brain functions fully, right? Like it's working 100%, it's efficient. So when you end up having sleep disturbances, you get aggravated motor symptoms. Patients have, when you get tired during the day because you didn't sleep well at night, patients have more tremors around those periods of being sleepy. You can see that they're slower to coordinate. I look at it as like being drunk. So if you've drank alcohol, you're slower to react. If you've had marijuana, you're slower to react. If you had Benadryl, you're slower to react. And our Parkinson's patients are slower to react, and that brain doesn't like it. And so they manifest showing their tremors. So some patients, again, we talk about motor symptoms, right? And so when you get better deep sleep, it also feels like the GI system works. It feels like the meds are working better. But at the same time, the muscles just feel like they fatigue easier when you haven't got good night's sleep. So every aspect of performance is worse. Like I said, reaction time, maybe there's higher risk of falls, and I see that quite a bit. Mood is definitely affected, and we see higher rates of depression and anxiety when people are not sleeping well. That heightened sense of depression is aggravated in patients with Parkinson's. They can feel, for no reason, a little bit more irritable. If they haven't slept well, they're a little bit more short with their spouses. And then also, we've seen that maybe, again, patients depend more on medication. So maybe certain medications are used to treat the Parkinson's. Certain antidepressants are also used, and some dopamine therapies that we use for Parkinson's may help sleep, or could also interfere with sleep. So we do see that dopamine is very important with mood. And if we allow for better, if we give a little bit of low dose dopamine therapies or Parkinson's meds at night, maybe that actually helps their sleep and also makes them feel less anxious at night, and then they actually sleep better. So it's this, cycle that we end up seeing. The last part is the cognition. Again, if you haven't slept well, you feel like you can't think well. So your working memory, your semantic memory, your verbal fluency, your executive functioning, all of those domains are affected, and even attention is reduced when you get poor night's sleep. The brain's much more vulnerable when we're in a fragmented stage of sleep at night. And, again, I feel like you never got to fully recharge, right? So just like you put your phone on the charger at night, and if it's got an interrupted charging, then you don't get a full charge, and then your phone only functions for a certain amount of day. That's what we see with Parkinson's, that patients feel like they don't get the full gamut of energy for the rest of that day. And there's a lot of fatigue, like by evening.
Okay, can I move away from Parkinson's for 1 second and take you as my private physician?
I charge by the hour.
Oh, okay, this is going to be 4 minutes, so let's split it.
4 minutes. Okay, we'll let this one slide.
Yesterday, I was talking to my cousin. I was having a very bad day. And nothing had happened, but I was feeling really anxious. My heart was beating faster. My mood was swinging all over the place, and I had no reason to be anxious nor sad. I was so anxious that I ended up at a fast food place, just eating horrible food just because I needed something different. And my cousin asked, okay, but did something happen today? Did you get any weird news? Or I was like, no. The only different thing today from any other day is that yesterday I had a very bad night. Like, I woke up 4 or 5 times. I know I didn't get any sleep. It was hard for me to fall asleep. So I'm asking, is lack of sleep also a problem for healthy people?
Yeah. I think we underestimate the importance of sleep. When you're young, you can accomplish so many things, and you have the energy and the reserve. And when you're in your, like, again, teens and 20s and 30s, you just grind, push through. I know that when I was in med school and I was in residency, the beeper is going off, and sometimes you get into a little bit of sleep, and then you just get woken up and startled, and it's really disruptive. But when you're in that young, healthy state, you push through, and there's different stressors. You think about the importance of, as we get older, or even just children, like, you think about a baby. Like, when babies don't get good sleep, they're cranky, they're irritable, they're whining, they're fighting over things. But you as a young adult, me and myself as a young adult, what happens is we don't sleep well, so we're just irritable, but our body manifests it differently. Maybe your heart is irritated. Maybe your heart was beating faster. And you're saying that you're feeling anxious, but you didn't sleep well, but your heart didn't get rested. And so you feel like you're always on edge. What ends up happening is you don't sleep well. Then you do things that are compensatory, not necessarily good for you, right? Then you're dependent on more coffee, and then you're having more caffeine, and then you're having bad foods like carbs that are overindulging, that your body doesn't need. And then, you get into this high sugar state and high inflammatory state. And so it may not be just that you didn't sleep well, that then you're also aggravating the system with things to stimulate you.
Okay, so my eating junk food, I am going to blame it on my lack of sleep.
It's easy to jump to that, like, and that's the discipline. Like, our body goes and craves what it wants, and sometimes certain foods, like, we call it junk food, but we go to it, right? And our body's saying, I need something, but it just somehow tricks you to getting into what you're comfortable with, and that you get the instant gratification with those type of foods.
That's why they're called comfort foods.
Exactly.
Okay. Thank you so much. Not charging. You're not charging me for this.
Not charging, no.
Because many people wanted to know, so it's not just for me.
Definitely. No, definitely. I mean, these are things that, and again, the focus here is Parkinson's, but, the more I see patients who are suffering with day-to-day issues, it makes you think, like, we need to take care of ourselves early, and I know a lot of people who listen to this podcast, maybe they're family members of patients with Parkinson's, loved ones who don't have any health neurological issues, but it is essential to make sure you take care of your body, eat right. There's sleep issues we all can improve upon. Like we'll talk about different things to avoid. I know questions coming up that you have for me. We want to address that too. So I can't wait to jump on what we have to avoid as well.
Awesome. So you talked about people that with Parkinson's begin by having I don't know
The REM sleep
complicated issues when
disturbances.
sleeping and maybe punching someone. So what can patients or caregivers do when sleep issues start impacting safety? Like, I don't know, acting out dreams or
Mhm.
excessive daytime sleepiness. I mean, it's not just he didn't sleep well, but it becomes a safety issue.
Yeah, no, it's a key thing. So impact on caregivers are a big deal as well. I want to make sure I address that. The sleep disturbances, individual with Parkinson's, as they act out their dreams, they've punched, their loved ones by accident. They've kicked, they've grabbed, they've choked because they're trying to defend themselves in that sleep state. That REM behavior disorder, sometimes patients feel like they're fighting or being attacked, and maybe they feel frozen or rigid at that state, so they feel stuck. So they always feel like the dreams are they're being attacked. So we've seen loved ones also get hurt. So it's important for the loved one to address that, talk to the patient saying, hey, you know what, you've been having these dreams. It's been much more excessive of late. And then having the conversation, what are we doing differently? Is it the action movies you're watching? Is it the horror, suspense? Is it some books you're reading that's aggravating it? Is it caffeine or certain alcohol that may be aggravating your sleep cycle? These are type of things that the caregivers, loved ones need to have a discussion, like making sure that the patient's aware that they're having these vivid dreams. Patients themselves may not be aware they're having these vivid dreams. They don't know they're talking in their sleep. So that's why, again, conversation has to start. There's many times in my clinic that I ask, how are sleep issues? What's going on? Do you talk in your sleep? And the patient says, nope. And then the loved one's there saying, yes, he does. Yes, she does. They're constant. They're regular. They're every week. They're every 2 days, whatever it may be. So safety for each of them. What we want to do is bedroom safety is the first thing, right? So you want to remove dangerous objects at the side of bed, maybe the nightstand, maybe sharp objects. Maybe consider padding the bed, those areas of the nightstand, the corners. Maybe having a mattress or rails on the floor, something to prevent the issue of it falling out. And if you do fall out, then you fall into something soft. You can get those bed rails that kind of slide in under the mattress, and so someone can grab on and pull themselves out, or if they hit against it, they're not falling out of the bed. Sometimes spouses sleep in separate rooms, and that may be necessary if someone's really active in sleep, but I also think pillows in between do make a difference. The other safety measure, got to be a medication review. We got to make sure, are there medicines that are aggravating sleep? Something new may be started and it could aggravate one's sleep cycles. You see a trend like that. Rarely does levodopa, the Parkinson's medicine that we typically use, aggravate it, but it could. Alcohol for sure. We need to be aware that alcohol irritates sleep cycles. It may make us drowsy and tired and relaxed, but it doesn't actually help sleep cycles. Even certain cannabis can be irritable for sleep cycles. I know CBD may be beneficial at certain low quantities, but maybe at a certain level, it may not be appropriate for sleep. Sleep hygiene we need to address. Regular sleep schedules. Try to get to bed in a consistent time. Don't push yourself too late. Maybe not push yourself with the stress things, such as getting work done right before you go to sleep. Daytime activities are a key part of safety. We got to make sure maybe we do more regular physical exercise, get ourselves tired so that our body is ready to go to sleep, and then limit maybe caffeine or nicotine. We don't want to have like coffee or tea like with dinner necessarily. We want to maybe stop 8 to 9 hours before we go to bed. Smoking itself can be a stimulant, and we see that can affect sleep. Patients wake up in the middle of the night because maybe they're getting a caffeine withdrawal, a nicotine withdrawal. You end up seeing these withdrawal phenomena, and then patients are waking up with like some degree of fast heartbeat too. So I would say in those circumstances, if you're still not sure, talk with your doctor, get in with a sleep specialist even. That way we can have a good conversation about even cognitive behavioral therapy. We've seen that helps with discussions to
I am
reduce
going
the
to
sleep.
violate confidentiality right now. And
No,
I'm going
don't
to
do
tell
that.
everyone that Dr. Thakkar is on Pacific time, which means that when we record these podcasts, it's about 5 or 6 a.m. Where he is. And he is always wide awake. Well, you can tell he's always like 100. How many hours a day do you sleep?
Well, I plan accordingly. I think I've got a supportive wife. So when I know that we're doing these recordings, I try to get to bed earlier. So if I'm waking up at 4 for a 5 o'clock podcast, I'm trying to make sure I at least get 7 hours sleep, maybe 6.5. Is the least. But I mean, if I can average about 6 hours, 7 hours, that's pretty good for these podcasts. But ideally, for myself at least, I know I'm comfortable if I get 7 hours of sleep. If I get more than 8 hours of sleep, it's not that good necessarily either. Sometimes I may not feel as good if I oversleep too.
I was also going to ask because I've heard that 7 to 8 hours, but then if you sleep 10 hours, that is not good. That no one should sleep that much.
Well, I think that if there's this hypersomnia and you're sleeping too much, there's a reason for it. You're probably, and this is what happens with a lot of our Parkinson patients, is they don't get into this deep stages of sleep. So they're always in this light stages of sleep, stage 1 and stage 2, and then they're interrupted. They don't get into stage 3 of sleep or into REM sleep. So the every time you reset stage 1, 2, you go back to 1, 2, you go back to 1, 2, 1, 2, 3, 1, 2, 1, 2, 3 REM. If you keep getting irritated, then you keep resetting your sleep. So then you never really get into the proper deep stage of sleep. And then you're by 4 in the morning, 5 in the morning, all of a sudden now you're getting into deep sleep. And that should have happened at, midnight. So a lot of long hours of sleep could also be a sign that patients are having like apnea. And that's why it's so important to get into a sleep doctor. And not everyone, everyone gets fearful when we talk about sleep doctors. Just because you're not sleeping well does not mean you have to wear a mask over your face. There's other things that we can do to help. Maybe a mouth guard, maybe it's oxygenation. Maybe there's other things that need to be adjusted for. But again, getting in with the sleep doctor makes sure that our brain is healthy, and we actually do like EEGs and have patients come into a lab or it's a home sleep study to make sure that we're not missing something that could be detrimental.
Okay. That makes absolute sense. How do you personally approach sleep care in your practice? Is it medication, routine building, as you just said, referrals to sleep specialists?
Yeah, it starts with sleep hygiene. So we have a questionnaire in our clinic. Whenever people come in, I'm always going through the checklist about their physical state, their emotional state, their sleep state. And I always tell people that, to be the best version of you have to eat right, you have to sleep right, you have to exercise. So sleep is a fundamental component. So we talk about sleep hygiene. As commented prior, we need to make sure that we're not taking anything before bed that aggravates sleep. You got to calm down on the sugars, the caffeine, alcohol, even late dinners. So I'm going to throw some things out here that may be mind-blowing for a lot of people, but sugars include not just sucrose, fructose, glucose, but lactose, right? What is lactose?
No.
Yeah, I know, exactly. You don't know how many times people think of this and then they think of, dairy, right? Dairy breaks down into lactose as being like, it's harmful. It's harmful for our brain actually at that certain time of when you actually need to get to sleep.
Time out. I've been told ever since I was born that if I cannot go to sleep, I should get a glass of warm milk.
Mm-hmm. Yeah. No? I don't think that's appropriate. I think, these are things that are handed down generationally, and I don't think this is smart now. The reason I can tell you is that the sensitive brains do not do well with sugars, right? And so when I'm talking about sensitive brains, when I see my patients with dementia, And I'm talking about even if they have Alzheimer's dementia, if they have a Parkinson's dementia, when you give them certain sugars, they don't act their best. They're more confused. They get a sugar spike and then they crash. And I'm telling you, if it affects them, it affects you, it affects me, it affects everybody. So dairy, right? This is a common phenomenon, and I know Breyers and Dryers is not going to be happy with me, and Haagen-Dazs is a favorite for a lot of my family members. But we have too much ice cream and sugars at night, and that dairy irritates our brain, and it does fundamentally affect the sleep cycles. So, just as we talk about caffeine being irritable or nicotine being irritable for the brain, dairy is toxic for the brain when it comes to sleep cycles. And I can assure you, if people, and I tell my patients that when you cut back on the ice creams and the desserts and you cut out for like 3 or 4 weeks, all of a sudden you're sleeping better. And we start seeing these trends. Like just one night of skipping, ice cream is not going to help your sleep cycle. I'm talking about changing fundamentally your sleep cycle. So sleep hygiene is important. What we got to think about this is, Ursula, when you go to another country and you got jet lag because you get so used to sleeping that way, it's like it takes weeks, right, to get back, or a week at least. So when you are creating a sleep pattern or sleep personality because of the way we've been doing it, it's hard to change all of a sudden and just say, okay, I'm going to stop alcohol one night, or I'm going to stop, dairy at night. Like it takes weeks to improve our sleep hygiene. So again, I would tell people it takes time. We really have to form like certain bonds and certain rules about that. But if you eat also late, in the Indian culture, we eat very late. And so we end up having food stuck kind of sitting in the stomach. We get GERD, we get reflux. So patients find it really hard to lay down after they've had a late meal. So Parkinson's patients have a lot of constipation. So again, eating early is very important. And now I'm actually even thinking about how the body is, our body needs to be in a certain state to exercise, right? You can't just get off the chair and just start running a marathon, right? You have to warm up, you have to train, but your body needs a certain time of day to be ready to move. You need a certain time to sleep. You need a certain time to digest, and then you need a certain time to sleep. And that digestion needs to be so many hours at least before you go to bed. So I do think that there should be a proper amount of fasting before you go to sleep, so that the body can then have that factory system, assembly line to digest, and then it's ready to sleep.
Okay, this episode is going to go long, but I still have another question I need to ask. These new wearables and tools that you can get, like the watches or the rings, are those good for actually checking out how you're sleeping?
I think these wearables are getting so good. I mean, they're just phenomenal in what they can do. Like these Aura rings and the Fitbits and even the Apple Watch. And there's so many different apps that are available that you can download from your phone. But they are getting really accurate to the point where it gives you a baseline of understanding what your sleep cycle is. It gets you a sense of how when you're getting into deep sleep, and then it gives you a score that then you can actually say like it's tangible. It makes sense to you how you feel. And when you don't get a good night's sleep and it gives you that score, you can say, oh man, it's pretty accurate. So you end up seeing how amazing they are and in giving you that feedback, and then you do change your behaviors. And I think patients with Parkinson's should be utilizing certain apps or wearables to help them understand their sleep and the importance of sleep. But again, I also now I'm looking at this as this is not just for the disease state of Parkinson's, right? This is for every day. I think we really should be understanding our sleep.
Because sometimes I think like they're selling us every single thing they can sell to us, but I've heard like the Aura ring is really good and it actually does tell you how your state is. And now I'm thinking maybe it's worth it.
Well, I mean, I think what we should do is we need our marketing team to reach out to Aura, get you and I a ring from Aura, and then we can do our data and due diligence, and then we can say, okay, has it made a difference in our sleep cycles?
It.
It's simple.
So let's go to the hopeful part of the podcasts. Are there any promising treatments, research, or even sleep technologies, aside from Aura, that you're excited about in helping Parkinson's patients get better rest?
Yeah, one thing is that from a hopeful standpoint is we can do so much more for patients if they are sleeping better. And I think what hopeful part of it is not just depending on a pill. We don't want to be so demanding on that we need more pills, and we want to be really careful that we're not taking too many meds at night to fall asleep, because the more meds we take at night that to help us sleep, right, then maybe we're more drowsy when we wake up and now we're a fall risk. So again, I've seen trends that in medicine, that I was even taught, that you need to give certain medicines and what we call benzodiazepines to help certain sleep disease states. Sometimes we're too quick to give those medicines, and we should only use it for very advanced sleep disturbances. But the research looks quite promising. There's a clinical trial involving Parkinson's patients that demonstrated even deep brain stimulation with this new adaptive version that is effective in reducing the motor symptoms compared to like the continuous kind of DBS that exists. And the study in UCSF actually indicated that this new form of adaptive DBS potentially alleviates the insomnia in patients with Parkinson's. So the research is showing that if we are in a better muscle relaxation state, we're not too rigid, that we can probably get into better quality of sleep when we have Parkinson's. And so there's more and more literature for that maybe will utilize appropriate medicines for those who can't get deep brain stimulation surgery. And then there's another promising drug trial in the UK. It's a clinical trial funded by the Parkinson's UK initiative, and they're investigating a drug. It's actually called SNT 4728, and it's looking to see in patients who have this REM behavior disorder if it can reduce brain inflammation, and then that may potentially delay or prevent development of Parkinson's. So if we slow down those REM sleep disturbances, maybe we don't get into Parkinson's, right? Because there's that theory that it happens years before, decades before developing Parkinson's. Maybe we slow down that prodrome phase, and then our symptoms aren't as exaggerated. So that's exciting. And then the sleep studies. What's extremely technology-wise is if you snore, or even if you don't snore, but your spouse says that you hold your breath at night numerous times, then you got to go see a sleep doctor. You got to get a sleep study, because even sleep apnea, getting that information technology, even mild versions could lead chronically over time to develop Parkinson's or dementia, by the way. I know we keep saying Parkinson's, but actually even apnea can create dementia or cognitive decline.
Any kind of snoring, like light snoring as well?
Well, it's affecting probably a clue that there's obstruction, right? So there could be some other, what we call pausing of the breath that we don't realize when we're not snoring. But the fact that you snore means there's an obstruction, so you're not probably exchanging the oxygen and CO2 properly.
Okay, I'm going to go see a sleep doctor.
Well, I mean, and again, sometimes you may even, if you are snoring, sometimes it may be that you see an allergist to make sure that there's nothing that's irritating the ear, nose, and throat areas, right? These sinuses. So that also can be important. And you know what's one of the biggest inflammatory issues that affect this area? Dairy, right? People are lactose intolerant and they get a lot of inflammation. They get a lot of runny nose, but then they snore a lot. So you end up seeing that when there's a lot of congestion, that's another big problem. So again, I think we have to change our mindset about dairy. As again, it may be just like caffeine and nicotine that could be disruptive for our health. And not to say that all caffeine is bad. I'm just saying you don't need it at night.
Dairy does not include oat milk, almond milk.
Yeah, those are the alternatives.
Okay, good. Okay, we're good. Okay, last question, because I know you have to go to work, and I could be asking you questions for like 10 more hours, but we need to do this quick. For anyone listening who's just now connecting sleep problems with a potential neurological issue, what's your advice? Next steps, but do not panic. not
If there's
panicking.
any neurological issue going on, right? Whether you have tremor, muscle coordination issues, balance issues, and there may be some sleep issue, I highly recommend you see a neurologist, right? So many neurologists, general neurologists, even of course myself, a Parkinson's specialist, go out and see someone so we could review your medications, examine you to make sure like that there's no early development of Parkinson's. Again, someone comes in my clinic and they may have like a certain degree of a thumb tremor, or like they're moving their hands in one slower than the other, and they're moving like one side doesn't move well. Maybe this is again something going on from the brain. So the thought process will be, let us do our due diligence and work up to make sure nothing else is going on that needs to be worked up. And then at the same time, go out there and see a sleep specialist. And the key thing about when you do see a sleep specialist is maybe they require you to do a sleep study, maybe they don't, right? But one thing I've learned, and this is again, even my PAs see this all the time, is that mild sleep apnea is toxic still. It's sleep apnea, right? What does sleep apnea mean? It means it's a sleep disorder when a person experiences pauses in their breathing, shallow breaths during sleep, with a frequency of 5 to maybe 15 times per hour that you're getting pausing of your breath, right? So if you're, seeing a baby and the baby doesn't breathe for 15 times in an hour, is that something safe? You wouldn't want that to happen to a baby. So why would you want it for yourself? And that's the definition of mild sleep apnea. So you yourself should manage it. Don't take it for granted. It needs to be treated, because again, a lot of neural health issues begin well before, in our 30s, in our 40s, in our 50s, well before we get other obvious changes that are physical or cognitive.
Okay, we're gonna wrap this up because I gotta get a consult with a sleep doctor. I gotta go buy a wearable, and I gotta throw all the milk away from my fridge.
Yeah. And then we should preface, right? Like, not everyone who has a sleep disorder is going to get Parkinson's. But again, it's important that if you have sleep issues, address it, pay attention to it, because we do see the data is that sleep problems can result over time in high rates of cognitive decline. So Alzheimer's is even being studied very much so in that prodrome phase, what's going on with our sleep that irritates these sensitive areas, right? So again, it is an exciting discussion. It's exciting to talk about. I know we went over time. Maybe we have to do another episode about sleep itself in the future.
I absolutely agree with you. Thank you so much. This has been eye-opening.
Yeah, and I hope we've changed habits for the better, and enjoy this episode.
Thank you so much, and we'll see you guys, everyone, on the 12th episode, which is coming really soon. Thank you, Dr. Thakkar.